Hello viewers, this is Wahida Kazi and today I'm here to discuss a new topic and it is related to COVID-19. Actually, I recently read a document. It is actually Directive1 issued by Chief Medical Officer of Health of Ontario. There are several directives and I thought, why don't I discuss the Directive 1 that was issued in March 12 and then revised on March 30th, and it is available publicly in the Ministry of Health and Long-Term Care Home website. So if you would like to read this document, you may visit that website and read about it. The purpose of my video is completely educational. I try to make some of the terms very simple for my viewers who may not have enough time to visit such websites. Maybe they are too busy at work and they don't have enough time to read, or sometimes you may not like the technical or legal jargons that are included in the document, like directives has some legal, the discussion. You may not be familiar with those terms. So in my video, I try to make it simple so that it is understandable for my viewers. So the Directive 1, actually this directive, if you can see that, it is directed towards the healthcare providers and the healthcare entities. So who are the healthcare providers? In general, we can say a person who is involved in providing healthcare to their client or patient. For example, a physician, a registered nurse, a PSW, a essential caregivers. These are the healthcare providers, maybe a pharmacist, a physiotherapist. And what is healthcare entities? Healthcare entities is also there are different types. For example, a hospital, a acute care hospital, a pharmacy, a long-term care home, a retirement home, an organization, for example, Ontario Health, integrated regional integrated health network. These are the example of health care entities who are actually involved in providing healthcare services for their clients. So this directive was published in March 12, and we all know that World Health Organization declared COVID-19 pandemic in March 11th. Then Public Health Ontario tried to gather lots of evidence during that time regarding this new emerging infection, COVID-19, and they tried to publish guidelines, especially the infection prevention and control guideline, so that this can be utilized in the healthcare settings to protect the health and safety of healthcare workers during the COVID-19 pandemic. So in this directive, it is important to understand why this directive actually, or what are the legal basis for this directive. People like someone who are working in public health, they're familiar with a legal tools. It's the Act, Health Protection Promotion Act in Ontario, and this Health Protection Promotion Act actually provide lots of power and authority to Chief Medical Officer of Health, a provincial public health and local public health, for example, Board of Health and Medical Officer of Health, Associated Medical Officer of Health, as well as the representative of those, the Medical Officer of Health, like a public health inspector. So this directive, as Ontario Health Protection Promotion Act has almost 106 sections, and every section actually has its own utilization and implications. The section 77.7, or the section 77, actually, that section describes the power of provincial public health. So to issue this directive, the Chief Medical Officer of Health actually utilized this section 77.7 from the Health Protection Promotion Act. In this section, actually, it says that when Chief Medical Officer of Health, in his or her opinion, there is a imminent or immediate health risks to the people of Ontario, then he or she can take any action or issue a directive or order to take certain actions or precautions to protect and save the health and safety of the Ontarians, that include healthcare providers. So this directive is basically directed towards the healthcare providers and healthcare entities. So because the COVID-19, this is we all know this disease discovered in China, and in March, around in December 2019, Hppa province, Wuhan city, and then from there, since they were affected, this spread gradually all over the world, and as an emerging or new infection. Although we know some of the information that it is a respiratory virus, and how mode of transmission is droplet and contact. So this is something, this virus is something that is new to the human, new to the world. So we still, until today, we don't have all sorts of evidence. Definitely there is lots of progress happen because of the research and because of the situation that we analysis or the scientists or the international and national health organization involved in lots of research. So we know lots of information about this virus right now, but in March this was there were not all, that complete knowledge was not available, right? So this directive is actually based on a precautionary principle. So in public health, precautionary principle is the term that is actually used when the expert or the decision makers, like a chief medical officer of health or the scientists, they would like to implement some measures to protect the health and safety of individuals. They take the maximum precautions to ensure that the health and safety of the people or the target people or the healthcare workers are protected, so that you don't have to you can avoid the harms and as much as possible, and you don't have to feel, or you don't have to say or feel sorry at the end not taking the adequate or maximum protections. This term is applicable when the knowledge is still pending, or we don't have enough all the evidence yet, and especially a new virus like COVID-19, this term is applicable. So this directive is also based on that precautionary principle. So the main objectives of this directive is to ensure that health and safety of healthcare providers are protected, because these are the frontline people who will expose themselves through their client or a patient, and if they become sick, then the whole healthcare system can be crippled, right? So in that sense, it is very important to ensure that all the healthcare organization or healthcare entity, they ensure that they have enough supply of PPE. PPE is the personal protective equipment. For example, we already know about it, like masks, different kind of masks, depending on what kind of activities you are going to provide. If it is a general service, healthcare service, you can wear the procedure masks. But if the procedure can generate the aerosol, then healthcare providers need to have N95 masks. So the point of care risk assessment need to be done before choosing, like how much or of how extent the PPE is required. PPE is could be full PPE, for example, the masks, face shield, goggles, gowns, gloves, or it could be just partial PPE. So based on the type of service you are going to provide. So now we have more directives, and all the healthcare sectors, they are doing universal masking. That means the healthcare providers are not going to take off masks during their shift unless the mask is contaminated or become wet, and they are always wearing masks to do the source control, so that if they are bringing that infection from outside, they are actually wearing the masks to protect the others, especially the vulnerable clients. And healthcare entities need to make sure they are in compliance with the Occupational Health and Safety Act, and they need to ensure that they have to check their inventory on a regular basis and notify or order the PPE even before those supply ran out in advance, so that never there is a gap of providing PPE to their healthcare providers. So this is a very important directive, and it is very important to protect the healthcare sectors and the healthcare providers. So that's all my discussion today. Hopefully my viewers who are in the healthcare sector, who are healthcare providers, are able to clarify a little bit. So I know that we all are worried, but we all have to make sure that we take enough precaution to save ourselves, so that we can save our clients or the patients. Thank you, and you have a wonderful time, and thank you for watching my video. Thank you.